Okay, so starting off with the newborn assessment, we can start with just noting the general flexion and movement of the baby. They should be flexed at the arms and legs. They should be crying, irritated a little bit, stuff like that. Then you can note the vital signs. You can listen the respiratory rate. Listen all quadrants. Should be clear with no wheezing. And listen for a full minute, and it should be 30 to 60 breaths. Next, you listen to the heart rate for a full minute, and it should be 110 to 160. The blood pressure should be 60 to 80 over 40 over 50 with an appropriate size cuff. And the temperature should be taking auxiliary, and normal is 37 Celsius or 98.6. So we can start by just looking at the skin of the baby. They should be pink, or it could be normal to be acrocyanotic, which is the bluish tinge to the hands and the feet. Assess any jaundice that could be present in the baby. The first 24 hours, they should not have any jaundice. So noting any like the sclera of the baby and the mucous membranes. You can test the jaundice by blanching any bony prominences and report any findings of jaundice. You can check the skin turgor on the belly. Their general appearance should be dry, soft, and a smooth texture. It is normal to have vernix and milia, which is white spots on the nose and the mouth. You can have Mongolian spots, which is a bluish-purple spots of pigmentation, usually found on the top of the bottom here. And you can have lanugo, which is little fine hairs, usually found on the shoulders and the back of the baby. Going to the head, you assess the fontanelles here, which you will have the anterior fontanelle, which is diamond-shaped in 5 centimeters, and you can palpate the posterior fontanelle, which is smaller and triangular shaped. You will palpate all the sutures. They should be flat. Any abnormalities such as caput cecedinum, which is swelling of the soft tissue caused by pressure during labor, or a cephalohematoma, which is collection of blood between the periosteum and the skull bone that covers it. You should report any of those findings. You would do a head circumference of the baby, which is at the eyebrow line all around the head. It should be 2 to 3 times larger than the chest. It'll be about 32 to 37 centimeters. Then it's a good time to do the length of the baby, which is the top of the head to the bottom of the toes. Make sure that the baby is fully stretched out. And then that's for that, the head. You can go to the eyes here. You can note the color of the eyes, which will be about a bluish gray color. Pen light's not working very well. And note the reaction of the eye light to the baby. The sclera is a bluish white color, and the iris is a deep blue color. You can note for any drainage or signs of infections, which would be like a greenish yellow color in the baby. And the eye movements for the baby is usually like a jerky random motion, and that's completely normal. And it's very normal for the baby to have a cry with no tears. Their lacrimal ducts are not fully developed yet. Heading down to the ears here, you would draw a line from the outer canvas of the baby's eyes to the top of the pinna. They should be a straight line. If they are higher or lower, report that because it is an abnormal finding. The ears should be soft and palpable and flexible. cartilage is formed, and you would do a loud sound to trigger the baby's hearing. They should react to it, a slight cry. Going to the nose, note the it should be midline, flat, and broad with a lack of bridge. You would assess the patency of the nostrils by closing the baby's mouth and closing each nostril one at a time. And you would monitor for any signs of like a nasal obstruction, such as flaring of the nares, cyanosis, or asphyxia. And you would note any drainage coming from the baby's nose too. Down to the mouth. This is where you would stroke the cheek here. For stimulus, the baby should turn its head towards the stimulus. And then you would stick your finger in the baby's mouth, and it should start a sucking reflex. You would palpate in the baby's mouth, note if there's any fetal teeth, or you would assess the palates. The soft and hard palate should be intact. You should have pink and moist gums, and the tongue should be freely moving, symmetrical, and should not protrude. Any of the opposite signs should be reported. Down to the neck here, it should be short, thick, and surrounded by skin folds. There shouldn't be any webbing. You would assess the neck for any swollen lymph nodes. You'd also evaluate any clavicle breaks, make sure those clavicles are intact. Check that the head can move from side to side and up and down. And down to the chest, it should be about a barrel-shaped. The baby's respirations are primarily diaphragmatic and abdominal. They should be moving at the same time. They shouldn't be retracted. The nipples should be prominent, well-formed, and symmetric. You would measure the nipples. They usually have 5 to 10 millimeter bud. And then you would measure the chest circumference at the nipple line all the way around, and it should be 30 to 35 centimeters. Going down to the abdomen, you can assess the umbilical cord. It should be odorless and exhibit the intestinal structures from the umbilical cord. You could assess the abdominal sounds in all 4 quadrants. Listening for a full minute. Bowel sound should be present 15 to 20 minutes following birth. You can note the general appearance, which is usually round, dome-shaped, and non-distended. And you'd palpate to make sure that it isn't tender or hard. You can go down here and assess the femoral arteries and the brachial up here. Doing it at the same time, they should be equal. We can move on to the genital area. We have a female baby here. Note the genitalia, which would be the both labias. The majora should be covering the minora and the clitoris. It is normal to have a whitish or blood discharge. That's completely normal. And it can usually be edematous after birth. And then on the back here, we should assess the patency of the anus, usually after a bowel movement, or you can stroke the cheek here and it should trigger the anal reflex. The anus should be present, patent, and not covered by a membrane, so make sure you assess that. So as far as the extremities, you should assess full range of motion on all extremities, moving them up and down, out, all fingers here. You can do the square window sign, which is bending the wrist down. It should, and assess the degrees of which that goes down. You can do the scarf sign, which you move the arm across the chest here and back. It's kind of like a scarf. You can do the heel to ear resistance, where you take the top of the foot and bring it to the ear. The ankle dorsiflexion, where you bring the ankle up. Note that the general posture of the baby should be flexed, usually. Any clicking when moving joints should not be heard. Checking these gluteal folds here, they should be symmetrical. If they're asymmetrical, that is usually a sign of hip dysplasia and should be further assessed. The soles of the feet should be well lined over 2/3 of the feet. You would assess the nail beds here as they should be pink and check all digits on hands and feet. And then on the back here, you would check the vertebrae and make sure that these are all intact here. And to check the scapula to make sure that it is symmetrical, because it could be indicative of a clavicle break if not. As far as reflexes go, the palmar grasping reflex, you can stimulate the newborn at the palm with a finger, and the baby should grasp it. The Morrow reflex is a loud noise or a lifted table. The newborn straightens their arms out and the hands outward while flexing the knees. The rooting reflex is when a baby is stimulated on the cheek or mouth. They should move towards it. I already talked about the sucking reflex while you stick your finger in the baby's mouth and they should suck on it. And as the last one is the stepping reflex, is where you have one foot touching and the other one should flex up. And that is it.